Hey, what's up, everyone? Welcome to the Wealthy Dentist Podcast. I'm your host, Ward Powell. And if you're a dentist looking to crack the code on how to grow your practice and dominate in this space, then stick around. You're in the right place. Every week, we're sitting down with some amazing dentists who are doing incredible things in their businesses. We're talking about everything from how they keep their teams loyal and dedicated to how they stay ahead of the game in this crazy, fast-changing industry. You'll hear about hacks like using virtual assistants to free up your time, strategies to make more sales with less effort, and even mind-blowing stories about patents and inventions that are changing the industry as we know it. And it's not just about growing your practice, it's also about finding out what works from a clinical perspective. Whether you're just starting or you're ready to scale to the next level, there's something here for you. So buckle up, hit that subscribe button, and let's dive in. Bianca Clark, she's going to share with us some wonderful information, and I just want to be quiet. And first of all, say to her, thank you so much for joining us. Glad for you. I'm so happy that you've gotten the opportunity to meet us and speak with us, speak with the community. How you doing today?
I'm doing well. And thank you so much for having me. And I'm really excited to do a deep dive into this conversation.
Awesome. Awesome. Well, we're ready for it. Can you, as I speak to most of the guests on the show, is what got you interested in dentistry? How did you get started with that?
So my father's a dentist,
Okay.
but I will also follow that up with I was not the daughter who was always in the dental practice.
Okay.
So probably up until I was a senior in high school, I wanted to be a radiologist.
Oh.
And I'd taken Kaplan preparatory courses for getting into medical school. But what really changed my mind were my interviews for dental school. So I interviewed at medical and dental school. But when I did my dental school interviews, Dr. Wisdom Coleman, who was one of the on the board of admissions for the University of Tennessee, he has since passed away,
Oh.
but pulled me aside and he said, dentistry is an amazing career. And if you give this a chance, I promise you will find happiness and I will take care of you. And I
Awesome.
really trusted in that. And I felt the environment to be extremely warm and welcoming and just really focused on ensuring that, we as students had everything we needed to be successful.
Mhm. Mhm.
So really what brought me to dentistry, even though my dad is a dentist, what brought me to dentistry were the personalities and the people that I met in
Mhm.
dentistry
Mhm.
that were just really felt like my type of people, very warm, very welcoming, very open, just family. And the medical school interviews I went to, I felt like were a little bit more sterile than what I was looking for, a little bit more subdued, as opposed to, and this is very much just my opinion, the interviews felt more along the lines of what can you bring to us versus how can we help you be a more well-rounded human being.
Mm.
And that was what was important to me.
Okay. Okay. And that's definitely important. I just wanted to, so tell me a little bit about your practice. I mean, do you have one office with how many chairs, how many staff members? What's your day like?
So I have two locations.
Hmm.
I do have a partner. His name is Dr. Ozzie Smith.
Hmm.
And I joined the practice in 2018 as a
Okay.
partner. I started out as an associate there. I migrated from New York to Chicago,
Hmm.
which is where I am now.
Okay.
And when I joined the practice, I found a a person, Ozzy, who really shared my same vision for dentistry,
Okay.
shared the passion that I have for helping patients, shared the passion that I had for technology, shared the passion that I had for, kind of speaking to some of the things that are on my hierarchy of needs, which is learning, being a lifelong learning, never resting on what you know, but always making sure that you are in a room with people who can expound your knowledge and people that can challenge the way that you think. And so just finding what I felt like was home was really important to me. And when I found that, I took the opportunity to approach him to ask if he was, looking for partnership opportunities. And at the time he was. So we have since expanded both of the practices. We have plumbed more chairs. And what that means is that when I first started in one location, we only had 3 chairs. We now have 5 in that one. We have 6 in the other location. We've got 3 doctors that work with us. They are associates in our practice. And I always say with because collaboration is important to me. And I never want anyone in our practices to feel like they work for us or that they're under us, but that this is an environment where you bring something to the table as well as I do. And we can share what we both know collectively and use that knowledge to help our patients. It's the same thing with our patient concierge team that we have at both locations, and the same thing as our hygienist. Everybody on our team is really, really dedicated not only to our patients, but always improving our systems, improving the offerings that we have for patients, and just really making our offices the best that they can be for our patient population.
That's great. That's great. So then if I could back up just a little bit, I heard you say New York.
Yes,
You went to the University of Tennessee, which I love,
I
Nashville.
did. Yes.
And so I'm wondering, now you're in Chicago.
Where
So,
might I be next? Carmen, San Diego, right? Um, So I did when I finished dental school, I did a residency program in Montefiore in the Bronx.
okay.
And I really fell in love with New York.
Ah.
And, initially I thought that I was going to be there for the rest of my dental career. But, the, best well-laid plans, they changed. My plans changed and, where I was going to end up changed. And I found myself in Chicago, and it's a lot colder than New York. It's a lot different than New York, but it's life takes you where you need to be.
Mm-hmm. Mm-hmm. So are
So,
you, oh, go ahead. I'm sorry.
oh, I was just gonna say, so sometimes just allowing life to lead you is how you find growth.
Mm-hmm. Mm-hmm. Yeah. Yeah. And I heard this one speaker say a few years back, one of the things that got me where I'm at today, she says, it's my gut. It's a
Yeah,
gut feeling. Sometimes you have to go with that. A lot of times
you do.
it's right.
You
So are
do.
you originally from Nashville or you
I'm
what?
originally, so I was born and raised well, I was born and lived in Pittsburgh, Pennsylvania for a while.
Okay.
But both of my parents are originally from Mississippi. My mom is from Bentonia, my dad is from Kosciuszko.
Okay.
And, like many young couples, my parents got married right out of college. My dad went to dental school at the University of Pittsburgh. And when he finished school, when you're young and you have a child, you need family. Um, you need community, you need help. And so they relocated back to Mississippi, where most of my family lived and still lives to this day, so that, they could have help. My mom was able to, though she had finished her undergrad degree, she was able to, with the help of our family, still be able to go to pharmacy school when I was probably around like 5 or 6. So, you know, and just speaking back to being a lifelong learner, my parents have been the same way. Like my
Mhm.
parents are always and have always instilled in me to never rest on what you know today, because it's going to change tomorrow.
Mhm. Mhm.
To always be flexible and not necessarily your values or your core, but to always be flexible and being very, very slow to say what you know.
Right.
Oh,
Exactly.
because what
Exactly.
is that?
Yeah. Right. Exactly. You know this, but you might not know
You
that.
might not know that. And just because you know it and it was true yesterday doesn't make it true
Exactly.
today.
Exactly. Exactly. So, any siblings?
Just me.
Oh, it's just you. Okay. All right. Well,
And a
hey,
bunch of dogs.
but
I had a lot of cousins. My mom is one of 12, so you can imagine how many cousins I had.
oh my goodness, the house
Yeah.
was always filled then in Mississippi, huh?
Always full, always full.
Okay, cool. So now, I know you do some specialty work,
Yeah.
biomimetic dentistry. Now, tell me a little bit about that. That's a specialty, I would assume.
It's an avenue of dentistry.
Harry. Okay, an avenue.
So biomimetic dentistry, the focus is recreating nature.
Okay.
So the principles behind which are to practice in a way that is conservative, because what we do know about dentistry is there's nothing that's going to be as aesthetically well-rounded or as functionally well-rounded as what you're born with. So the goal is not to remove and replace, but to heal and build. So using materials that allow for more of a reliance on adhesion dentistry versus dentistry that is focused on materials. So as opposed to changing your tooth to fit the material, I am choosing materials based upon your natural biological substructure.
All right.
So the goal is to just allow you to have any type of prosthetic, whether it's a filling, whether it's a crown, an inlay, or an onlay, but to allow you to have something that really truly creates harmony because we are replacing something. And unfortunately, I don't care if you are the best dentist on the planet. There's nothing that is going to ever feel as natural as your natural tooth structure.
Mhm.
So the goal in biomimetic dentistry is really to just try to get as close to that as possible.
Mhm. So you combine that. Well, that I mean, I guess that does rather relate to the idea of cosmetic dentistry.
Hmm.
Bind those together, and you're looking
But
at.
you've seen a huge shift in the cosmetic realm in probably the last 10 years. Huge shift.
Okay, talk about that.
Um, trends change, and
Hmm.
it's the same thing for teeth. It
Hmm.
used to be everybody wanted Hollywood white. Everybody wanted, bigger, the brighter, the
Yeah,
better. You
right.
know, People associated big white teeth with status and wealth.
Yeah.
But we have really seen, I would say, probably during and post COVID, a resurgence of natural dentistry. People come into the practice and they want teeth that look like teeth. They
Hmm.
want an enhancement. A lot of what we do now is digitally designed. So we are able to take the elements of your smile that you really love, the contours that you love, the inclines that you love,
Hmm.
and recreate that harmony and recreate that balance, but just elevate it. The goal of aesthetic dentistry and cosmetic dentistry, at least in my opinion, and I am but one person, has shifted from, you know, restructuring or recreating and has shifted to revitalizing and
Hmm.
reinvigorating and, not taking on an approach of demolishing what's there, but as I said before, taking the elements that we love and bringing those to the forefront and altering, I won't say removing, but altering the elements that we don't appreciate, that we don't like, and just creating harmony around masking those things
Mm.
so that you can have the look that you're looking for.
Okay.
Now, you can still find somebody in a basement that will give you some, big white Air Force One's teeth, but there really has, and I love it. There really has been a shift that we've seen in the dental community that just is really very nature focused, very harmony focused, as opposed to a cookie cutter, someone bringing you a picture and saying, well, this is the smile that I like, that I want. That doesn't translate to real life. Just because you want something doesn't mean it's for you, but being respectful of the architecture of someone's face, being respectful of how your face fits together and not infringing upon that relationship. And that's when you get into smiles that look unnatural, when you encroach upon stepping outside of your natural structure. That's when you get into smiles that people will kind of don't really have the best things to say about.
Mm, mm. So then now, here I am like wondering, I know we had a little conversation earlier, so how far does that connect or disconnect with holistic dentistry?
So, holistic dentistry, the root of it is relying on materials that are not harmful. You can really get into the weeds of holistic dentistry and start doing things like, using ozone therapy. You can get into the weeds of doing things like, using a extraoral suction devices to make sure that amalgams are removed safely. You can get into smart therapies. Um, and there is a particular subset of patients that appeals to, which is not a bad thing. Um, it's not for everyone. It's kind of the same people that tend to not want to participate in fabrics that are synthetic or things like that. They tend to be more of the patients that seek out a holistic dentist. Um, and it's not a bad thing. It's just very different. But I think if you are a dentist that is practicing with your patient's best interest in mind, part of your practice can't help but be holistic because you're going to be investing in products that are safe, products that are healthy, products that have been tested and shown to be compatible to the oral cavity. Um, Holistic dentistry, I feel like used to have a bad reputation for kind of being the granola crunchy kind of thing. But, people, at least in my opinion, have really started to embrace the fact that the oral cavity is the gateway to your entire body. You know, your body doesn't operate as a piece, it's a whole. Your oral cavity really does have an impact on your systemic health, your whole body health, and as more people are starting to realize that and more people are starting to understand that, they're seeking out dentists that do keep that in mind.
Mm,
And so that's why I say I use the term holistic loosely, because whole body health to me is more important than kind of being really strict to the idea of being a holistic dentist. So even when patients come into my practice, one of the things that we do is we really take a lot of time in investing in information gathering. My practice, we do see patients that don't have dental insurance, but we also see a plethora of patients that do have insurance.
mhm,
But our values and our core is education.
mhm,
And part of educating patients is, allowing patients to understand and digest that your oral cavity really does have a very large role in your whole body health.
mhm,
There's a lot of testing that is available on the market to test your saliva for the amounts of bacteria that are present, the really heavy hitting bacteria associated with gum disease called P. gingivalis. It's been implicated in rheumatoid arthritis, gout, cardiovascular disease, cancers, um, hypertension, you know, it's just a really nasty bacteria that once it's introduced, we can't ever get rid of. But what we can do is talk to patients about how to keep those levels at a manageable level so that we can maintain not only the oral cavity, but just kind of ensure that down the road, patients are able to navigate life as healthy as possible.
And what did you call it? What was that term again?
Whole body health,
No, no, the
the bacteria,
bacteria. Yes,
it's P. gingivalis.
P. gingivalis.
Mm-hmm.
Gingivalis. My goodness. Oh my God.
Yeah. So there's been a lot of data and research that's, kind of coming to the forefront now about the importance of having these types of conversations with patients. And, it's not just, okay, well, you come in and you get your tooth fixed. When you go to see your dentist should be showing you photographs of what's in your mouth. Your dentist should be talking to you about the way that your teeth fit together. Your dentist should be talking to you about, moving forward in a way that not only increases the longevity or the probability that you will be able to maintain your teeth, but how to ensure that when you reach 90 years old and, your dexterity changes and the way that you can live your life changes, that you have set yourself up for success so that you can navigate that new phase of life.
Mm, wow. I got to keep that in mind. My goodness, I'm learning so much
Well,
here.
everybody's living longer these days. We
Yeah.
see more, octogenarians, more people that are in their hundreds, 105. And, you know, I always remind my patients that just because it's not a problem today and it doesn't bother you today, you have to think about what does you look like at 90? What does you
Mm-hmm.
at 90? Because that's the reality. A lot of people will live to be that age,
Mm-hmm.
and we want people to live longer. We
Mm-hmm.
want people to live not only longer, but also healthier.
Mm-hmm. Yeah, so you don't just have to live in certain zones to have that centurion lifestyle.
No, you don't.
Yeah.
Listen, if the retirement age is 80, you want to be able to enjoy it for another 20 years. You want to live to be 100.
I had a friend some years ago that would say, I'm going to live to 103. He would say that all the time. It's like, my goodness, man, you really? You want to
But you
live
know
that?
what? I feel like 103 in the 80s seemed, you're crazy.
Right.
But 2025, 103 is like,
That's doable.
that's doable, you know? But it's up to you to choose what type of 103 you want to be.
Oh, that is so true. That is like hitting the nail on the hammer on the nail on the hammer, or the nail with the hammer. Then whatever. But you, you get
Hit the
my
nail on the
point.
head.
Thank you. Well, hey, but you know what? I am having so as such I mean, I'm so excited about this information you sharing with me that I don't know, I'm beside myself. So tell me, how does a day look like for you when you start your day? I mean, I know the dogs are up and playing around, right? So when you, and because they already know the
I
routine.
never get a moment's peace.
Right.
I'm
So
fighting for my life every day with these dogs. I'm telling you.
I can believe it. I can believe it. So you have two pitties or just one?
Well, I have one pit bull and I have one border collie Australian Shepherd mix, but he's
Ah,
60. So that's a whole host of other things. His quality of life is very different.
okay.
Yeah.
Wow. Yeah.
But my typical day is, if it's a day where I'm seeing patients, I am a preparer. So the night before, I'm always going to look at my schedule. If it's a Sunday, I'm going to look at my schedule for the week. To me, being prepared brings calmness.
Yeah.
I find strength and I find power in being prepared. Now, obviously, things can arise, things can happen, but ultimately, if I have some broad idea of what is in store for me for the week, then mentally I can wrap my head around the way that my day will work.
Mhm.
We have two hygienist providers that work with us. They have their own schedule. I have my own column of schedules, and then my other doctor that works with me has his own column of schedules. Um, we really, as a practice, value giving patients the time that they need. We are a busy practice. Both offices are very busy. We do implants. Um, I do smile rejuvenations. We do injectables. I have personally taken on the endeavor of incorporating 3D printing into our practices. So I'm 3D printing a lot of things for patients these days. So we really have what I consider a rehabilitative, restorative, or I would even say complex restorative, rejuvenative type of dental practice. It's busy, but it's still very patient centric, which is important to us.
Hmm. Hmm.
We don't want anybody to leave and feel that they haven't been heard.
Yeah. Yeah, with the 3D printing, it makes it a little easier with that part of the of the practice, I would assume.
It helps a lot. I got into the 3D printing world because I was seeing a lot of patients, especially post-COVID, a lot of clenching and grinding, stress related,
Hmm.
airway related. And that's one thing that we see a lot more now is that there are implications between the way that our jaws are shaped and our airways. So just circling back to whole body health, if we have a breathing issue, it affects the way that we breathe, which affects the way that our jaws develop. Um, Even when it comes to orthodontics, in orthodontics, we see a lot more of patients that are, or I would say doctors that are working on expanding versus removing and retracting things
Hmm.
when applicable. Um, and what I was starting to see post COVID were a lot of patients with a lot of really big broken fillings. Now, if you have a big broken filling, you sometimes can get another filling, but other times you are, regaled to a inlay that's porcelain or an ollie that's porcelain. But even those types of materials require a certain amount of thickness to be clinically sound and to be able to allow you to function. And that really started a deep dive for me into what can I give patients that's an intermediary that still would replicate what is natural, but also allows me to be conservative. Conservative dentistry is very near and dear to my heart. It's it's a subset of dentistry that I think just kind of circling back to what I said before, sets people up for success because the reality is nothing lasts forever.
That's true.
If I can give you something that restores you to function and can last you 10 years, and let's say it breaks or it does fail, you still have another option. You know, one of the things that we do see, especially with patients that will have really big amalgam or silver fillings, is that if an amalgam filling breaks or if a tooth is cracked, a lot of times that's removing the tooth or that's a crown. You really have no other option.
Choices.
Um, so that that fueled me to kind of start to look into what can we do for patients that allows patients to still exist in a realm of health, but doesn't mean I have to take a tooth out to fix it.
Mm.
Fix it.
So what type of materials do you use that are uh, non-invasive, um, that are
So
natural?
we're not using any silver fillings. We are an amalgam-free practice.
Mm.
If patients, let's say, have a really big filling, um, instead of saying, okay, well, your big filling broke, so now you have to have a crown. I can replace that with something that's 3D printed that is a filling that might be mixed with ceramic, which is porcelain, or
Mm.
might be mixed with zirconia, which is once oxidized is considered a ceramic as well. That just gives patients an opportunity to not have to make that big jump. The more of your tooth that you have, the better for the life of that tooth down the road.
And the better your health, I would assume.
The better your health, 100%.
Okay, so you said something earlier that I was kind of like, wow, the way you breathe is going to have some degree of, I guess, responsiveness towards how your jaw is created or your
Yeah.
jaw size. Oh my God, I never thought of that. Never heard such a thing.
We're designed to breathe through our noses.
Hmm.
So when you get into breathing through your mouth, especially when you're young and your jaws are still developing,
Hmm.
breathing through your mouth restricts the way that your jaw develops because now your tongue is in a position that it shouldn't be. So now that your tongue is in the wrong position and the improper position, the tongue can't help guide the growth of your jaws.
Hmm.
And so even in children, like we're starting to see a lot more interventional orthodontics, meaning like when we have kids that come into the practice,
Hmm.
instead of saying, oh, well, we'll wait until they have all their permanent teeth, we're evaluating to see what their airway looks like. Do they need to see an ENT? Are their tonsils hypertrophic? Are they inflamed? Are they always really big and bulbous? Is
Mm.
that creating airway issues and affecting, airflow? And what do we also know about airflow? Even as an adult, if you have sleep apnea, that decreases your life expectancy. It affects your ability to concentrate. It affects your ability to be able to process information because your brain is not getting the amount of oxygen that it needs. It's the same thing for children.
Mm.
There are correlations between airway and breathing and ADHD, the ability to communicate, the ability to process information and focus in children.
Mm.
So incorporating airway into practices is something that we're starting to see a lot of practices develop. And not necessarily that you have to be a dentist that focuses on airway management, but
Mm.
you at least on the spectrum of being able to recognize when there could be an airway issue and helping that patient get the help and guidance they need to be able to diagnose, and if there is a problem, appropriately remedy it.
Mm.
So, if I see a patient that comes in, if they're a pediatric patient, if they're a kid, and the tonsils are always inflamed, you're immediately going to get a recommendation to an ENT.
Mm.
I see, a kid that has an arch that's very narrow, same thing. We're going to be evaluating. Is this a oral habit issue? Is there a thumb sucking? Is there a pacifier that's being used beyond an appropriate age? Um, does the patient have, chronic sinus inflammation or chronic sinus infection that's preventing them from being able to breathe normally and have a normal circulation of air? Those are patients that will wear, I'm not sure if you're familiar, but they'll wear palatal expanders, which are devices that push your teeth out to widen your palate so that you have enough space to allow for air to circulate normally.
Oh, wow. Wow, this has been an education. So then I had an earlier question. I kind of
I
extend.
talk a lot, Ward.
Yeah. But it's great information. It's like, oh my goodness. So tell me this. I got it now. So tell me this. What I mean, how is your business structured in terms of how do you know or have an idea of how many um uh both fee for service clients that you're going to bring in as opposed to insurance clients? How is that working for you?
So most of our referral base is in-house. So most of our patients come from patients that are existing, which I think is a great thing because it's really a testament to us doing something right.
Mm-hmm.
Um, I would say we're probably about 20% fee for service, meaning patients that pay up front. We do have an in-office membership for patients if
Mm-hmm.
they don't have what I call the insurance coupon, because the reality of dental insurance is that it is a coupon. It's not designed to pay for everything,
Yes, yes, yes.
designed to, create an easement on the fees that are there.
Mm-hmm. Mm-hmm.
We truly look at being in network with some insurances as a way to market to patients who otherwise may be somewhere else. But, luckily we've been able to exist in a realm that we haven't had to compromise any of the ways that we practice, and still being able to provide, the best of care to patients, whether they are fee for service or, patients that use an insurance coupon.
Mhm. So how does your company um, manage to, if you will, COVID?
Oh, COVID was rough. We really just heavily leaned into being flexible, to be honest. COVID created an environment where you had to listen, Monday might be this, Monday evening might be that. But, just being flexible. And I will say this, that I think the beautiful thing about COVID is that COVID really shook things up, at least for us,
Mhm.
and really made us sit down and reevaluate the systems that we had in place, what systems worked, what systems didn't. bringing those things that were positive and helpful and beneficial to the forefront, and then letting go of some of the things that didn't serve us or didn't serve our patients.
Hmm.
Luckily, we didn't have to let anyone go during COVID. We were able to retain all of our team. Some of our team have since left for other opportunities. Always wish people, the best wherever they may be. But, we just really focused on making sure that our team had what they needed to be able to rely on us. And then the same thing for our patients. Like if patients, we had an emergency line, if patients needed something, we were always ready and available to them.
Hmm.
Um, whatever mandates came forth, making sure we operated under the guidelines of those mandates to keep our patients and our team safe, whatever safe looked like at the time, but just making sure that, our team was comfortable, our patients were comfortable, and we were able to get back to business. But I will say that what really truly helped us is that we were flexible. We did not allow ourselves to say, well, this is how we've done things, this is how we're going to do it.
Hmm.
We
Yes.
we just said, okay, well, this came out today. We've got to navigate this. We're going to do this today. And even just being open and honest with our team and even our patients probably got on their nerves, but we would send email updates to patients with like, hi, this is the latest that we have, passing this on to you for your knowledge. Do what you will with this. But when you come into the practice, if you feel more comfortable operating in this zone, let us know, you
Hmm.
know,
Hmm.
and just really being open and listening to what people needed because everybody was scared. Nobody knew what was going on. This was new for everybody. And, the reality is we may have another pandemic at some point in time. But I think just listening to those around you and listening to what makes people feel safe and what makes people feel like they can trust you with the ability to keep them safe just sets you up for success.
Hmm. Wow. So, what was your aha moment? Did you have an aha moment? Have you had an aha moment? And
I probably have an aha moment every day, Ward. Um, you know, dentistry is very humbling because you really become not only the steward of oral health care for patients, but you become a psychiatrist, a friend, a confidant. You wear a lot of hats as a dentist. Even if you don't own your own practice, you wear so many hats. So you will forever have aha moments. Is there one moment in time that made me be like, okay, this is it? I've had several, and my team will tell you all the time, the way I practice 2 years ago is not the way I practice today. And the way I'm going to practice 2 years from now is not going to be the same.
Right.
And as we see technology improve and progress, as we see materials improve and progress, you have to be willing to adopt that. You have to be willing to grow and to learn. And, with the way that we communicate, it's a global community now,
Yes. Yes.
I have friends that are dentists in Australia. I have friends that are dentists in the UK. I have friends that are dentists in Hong Kong, Vietnam, across the world, and learning from them. Everybody truly has the ability to teach you something. So those are my aha moments. I would say my aha moments really truly come from just communicating with people and being open to other ideas and not being so rigid in how I think and rigid in how I function.
Mhm.
That would be my aha moment, realizing the more I know, the less I know.
Oh, wow. Yeah. At some point through our lives, we get to that point, hopefully, right? Some
Yeah,
some people never get there, but when you
true.
when you do get there, I mean, like you said, it's real humbling and it's actually really fortunate to have something like that happen or have that aha moment and say to yourself, I didn't know that, and I know I didn't know that, but I want to know more, right?
Yeah. You have them where you say, you know what? I ain't shit. I was running around here thinking I knew this, and here
Right,
comes something else to show me otherwise.
right, exactly. So tell me, what was your most, I guess, challenging point in your career?
My most challenging point, you know,
In either business
I would say
or
starting over. You know, when I relocated from New York to Chicago, it really
um,
was a season of starting over.
okay.
I didn't have any connections here. You know, the opportunities that I found here were just by reaching out to people, you know, reaching out to other dentists that I knew that may have gone to school here or had some connection to Chicago. But starting over, I would say was probably a really difficult and eye-opening experience because when I left New York, I had been in the practice that I was in, I had been there for 5 years. You know,
Wow.
I had a steady patient base. I was doing very well financially. I had a great support system. My friends were there. I had family there. So, you know, coming to a place where you don't really know anybody is a very humbling and interesting experience, you know, because you never know what to expect.
Yeah. Yeah. Wow. Okay. So what,
And starting over older, you know, when I moved to Chicago, I was in my late 30s.
hmm.
So those are the times where people say, "Oh, you know, I'm getting into my 40s. I'll be 40 soon. I'm getting into my 40s. I'm going to retire and slow down." And, you know, I was starting over.
Well, I mean, like you said, you're a lifelong learner. So, I mean, it was nothing that you weren't going to like not learn during the process, right?
Yes, and you know what? If I had to, I'd start over again tomorrow.
Oh, wow. Wow. That's pretty
Why not?
no, I mean, like I'm not against that at all.
Gordon's
I,
like, I don't know about that
Oh
now.
no, 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 really. You'd be surprised. You'd be surprised, I mean, I just started the podcast last year, so I mean that was something new, and I was totally out of my comfort zone thinking about it. I'm like, oh my God, this is not what I do. I'm a wealth strategist. I don't do podcasts with dentists, you know. But I love dentists. I
We're an
do. I mean,
entertaining
like
people.
you said earlier, they're warm people. I've never met a dentist that I didn't like yet. I'm not saying that's not going to happen. Uh, but every dentist I get an opportunity to talk to, it's been great.
Yeah.
It's been
You
really
have
wonderful. I don't know. It's just that attitude they have. I don't know what it is,
have
but
a the privilege of meeting people in a vulnerable position. You know, when you lean someone back and you have them opening their mouths, that's a position of power that you have over someone. So I think most dentists respect that position and create environments of peace and safety for patients.
yeah,
Um, and I think having part of that means also having to be a warm person, you know? I mean,
yeah.
it's a lot to ask someone to, hi, hey, I've never met you before, but come on, lean back, open your mouth up. Like that's a lot. Like where else on the planet would it be acceptable to tell someone, open your mouth, let me see. You know what I mean? So it's just you have to be able to have a demeanor of encouraging people to drop that armor and to be open and honest with you.
Right. Trust. Yeah. The speed of trust. Oh my
And
God.
I tell patients all the time, listen, my vibe is my vibe. If my vibe doesn't work for you, I have a homegirl down the street. You might like her. You can see my partner. You can see any dentist in this practice that you want to. The important thing is that you're comfortable and you're open and honest.
That's
That's the
great.
only way those relationships work.
Yeah, yeah, that's a very calm, cool, collective response, or even like proactive uh conversation that one should have and does have, or in your case, you do have with your patients. That's great. I mean, that's wonderful. So tell me, what have we missed? We've talked a little bit. What have I not asked you? What have you not shared with us that you think you should?
Number one, Don't be afraid to take that step, whether you haven't seen a dentist in 5 years, 10 years, 15 years, or ever. You can't leave this planet without seeing the dentist or the coroner. It's gonna happen. So, while you're here, go see the dentist. Take that step. Don't be afraid. There are great dentists out there. There are people who won't judge you. There are people who won't um, chastise you. There are people who are genuinely invested in seeing you prosper. If you go someplace and that's not what you find, go to the next one. They're out there.
Well said. Well said. So then, if someone wanted to contact you just to have that conversation that they wanted to have with you regarding some of the things that you said, or want to use your services, how would they get in contact with you?
We have a website. It's smilestudiochicago.com, SMILESTUDIOCHICAGO.com. All of our contact information is on our website. I'll also send it to you if you want to post it in the link above. But, we are accepting new patients, always happy to have people as part of the Smile Studio family. And, I tell people all the time, I can't be everybody's dentist and everybody can't be my patient. But if you and I don't work out, I will gladly help you find someone who will work out for you.
Perfect. Thank you so much,
My
Dr.
pleasure.
for coming in and speaking to our community today. I really appreciate you taking the time out and joining us.
Anytime, I appreciate you for reaching out and, giving me an opportunity to speak to, your public, speak to your community and just share what little morsel of knowledge I have. Because it is a morsel, You talk to me next month, I might have something else to say.
I'm sure you will. I'm sure you would. As a matter of fact, we will talk again for sure.
I'd love
Thank you
that.
again, Dr. Clark. Thank you.
Thank you.
All right.